Asthma is another condition. I've actually seen somebody with asthma that they use the light, the mini canopy on their lungs, and they were able to see that the whole day they didn't need the puffer. Another person with ARDS found that normally if they would do anything to exert themselves, if they tried to do a quick sprint, they'd have a difficult time being able to breathe, like having to stop and just wheeze. Well, one of the individuals, she had done the treatment that day, and she was running out of time to go to Home Depot, and she parked her car and quickly, without thinking, ran to the door to get in yet before they closed, and she stopped and she realized that she was gasping for air, that she was much better, and the only thing she could attribute it to was the fact that used the light on her lungs. Now in my case, when I had COVID, I had double lung pneumonia. My blood oxygen was measured at 80%, and I started using the light right away on my lungs every day, 3 times a day, for about 20 minutes front and 20 minutes on the back. And in 2.5 weeks, I started coughing real bad, and I thought I actually was getting worse. But as it turned out, I went to the hospital. They did another set of x-rays and another panel for my blood and everything. And they said my lungs were significantly improved from the last set of x-rays, and they were quite surprised that in 2.5 weeks I had seen such a recovery from my lungs. And every time I did the light therapy, my lungs, my blood oxygen would go up 1% to 2% and then fall after a little bit back down. But over the 2.5 weeks, I started getting up into the lower 90s, and you could see from that side that I was improving.